rather ironic that I'm talking to you today about climate change on the hottest day of the year so far, a few days of extreme heat very early in the season that we wouldn't normally expect. But I'm, for the next few minutes, going to give you a broad overview and perspective of climate change and what it means for infection and infectious diseases. I'm going to hopefully take you through a little bit of myth busting, and some of the, a couple of the points that I'm going to make will be helpful to you. And I will boundary this presentation around health and the impact on health, but importantly, particularly today as well, as the Climate Change Committee today published another report on our progress towards adaptation. I want to spend a couple of minutes just talking about the difference between mitigation and adaptation, whereas previously we've focused on mitigation and taking action to avoid increasing greenhouse gas production and a warming planet, but actually we've moved beyond the point now of which mitigation alone is going to help us resolve this issue. And then I'll focus in on some of the infection prevention and control and infectious disease aspects, just a few things for you to think about. So my role is as professional lead for sustainability, and I find myself in the situation where we were with procurement, and Claire will probably recognise this, where when we started talking to RCM members around procurement, the importance of nurses engaging in procurement, it wasn't language that necessarily resonated with them. Procurement was something somebody else did. Nurses used the language of consumables or supplies. And the language of sustainability is evolving and isn't yet part of the everyday mindset and communication of nursing teams, but it is certainly increasing and becoming more common. So sustainability and climate change, the language can be used interchangeably, but I like this slide because nurses do engage on sustainability, but they tend to be more engaged if we talk about climate action, and particularly environmental climate action. So climate action is just one form of sustainability. And what it is in essence is thinking about the big picture and how we're acting and how we're working now, and what we're taking from the earth and what that means for the future and future generations. So the environmental sustainability aspects are great at drawing people in, but environmental sustainability isn't the only part of sustainability that we need to focus on. So some fun facts for you. The first one, which might sound very simple, but weather and climate are two completely different things. We're experiencing some hot weather at the moment. Weather is something that occurs over a short period of time, a few days, a few weeks, potentially a few months. But climate is measured over much longer periods of time. So when we talk about climate change, we're talking about changes in patterns of weather over 20 to 30 years. So it's not just one hot day or two hot days or a couple of rainy days. This is long-term changes that have not been reversed. The last 8 years have been the warmest on record, and I'm quite a visual person. So seeing a graph like this that represents climate change, warming over a longer period of time, puts it into perspective for me. But along with climate and the impact on health, actually, we have to think about the wider impact on our planet. And these images here are from the Stockholm Resilience Centre, which is doing a huge amount of work and actually talks about planetary boundaries that are impacted by our warming planet. And the climate emergency is also an ecological emergency, because heat affects other life on our planet, and it affects our planetary systems. And as humans, just one species on our planet. We very closely interact with other life and are dependent on it, but we also require interaction with the environment around us. So in 2009, you can see that of the 9 planetary boundaries, 3 have been exceeded. Fast forward to 2023, which is not actually, there's not a lot of years between 2009 and 2023. You can see that 6 of the 9 planetary boundaries are being exceeded. So we are moving into uncharted territory in terms of a planetary system that we as humans rely on, as does the rest of life on our planet. And for me, when I talk about climate change and what's happened, it's not about blame because somebody invented something in 1840 that created this, or the Industrial Revolution. We are where we are. But what we have to do now is think about cause and effect, and how we, if these generations, our children, our grandchildren, how are we going to work together to resolve this? So very simply put, this for me is about cause and effect. It's a ripple effect of what we do as humans and the impact it has on our planet. Now, I want to counter that, first of all, by saying that actually a tremendous amount of good has occurred as a result of humans developing over time, particularly if you think about health. We've reduced childhood mortality, we have introduced medicines, vaccines, our knowledge has expanded, and we have the potential to really improve lives and extend the quality of life that we have. But in becoming more industrialized, in becoming more wealthy, and investing money, actually there has been an effect. So for those of you at the back, you won't be able to see this in detail, but on the left are the socio-economic trends, so the sorts of things we have done as humans. So our population has increased significantly. There are now nearly 8 billion of us on the planet. For 8 billion people, we have to produce more food, so the fertilizer consumption has gone up. Many of us now live in cities, so urban population's gone up, energy use has increased, we've dammed water, we use more water, we measure success through GDP. The Earth system trends on the right-hand side show the ripple effect of all this. So you can see that greenhouse gas production here, as carbon dioxide, nitrous oxide and methane have increased in a corresponding way, as has stratospheric ozone. As a result of these, ocean acidification has increased. There's more marine fish capture as we use it as a source of food, and we've used more land, chopped down trees to domesticate for our use. So this is about cause and effect, and I find this quite helpful when I'm thinking about my actions at home. So pledges and impact, very simply put, this is just a graph that shows the projected temperatures and where we might go to based on the pledges and versus action. What's clear, because in 2024 it was confirmed that we did, for a short period of time, exceed 1.5 degrees of global warming, but actually 1.5 degrees is a policy limit, it's not a physical limit. So nothing dramatic is going to happen on the day that we exceed 1.5 degrees of warming above pre-industrial levels, which was the level set by the Paris Agreement. Confirmation of exceeding 1.5 degrees will actually take many years because the science will want to measure it over at least 10 to 15 years. So by the time we confirm officially that we've exceeded 1.5 degrees of warming, which we aimed to stay below, we will be nearer to 2 degrees and we will be approaching significant challenges at that time. And a warming planet and the impact of climate change is not just about the impact on health. Here, the World Economic Forum has looked at risks from a financial perspective, and a warming planet and the impacts of climate change is recognised significantly. And it's estimated that in 10 years' time, it will make up the top 4 risks, financial risks, globally. But this is a huge issue. And as healthcare professionals, and particularly as nurses, we cannot solve this problem alone. One, it is not our responsibility. It is every citizen's responsibility, whatever role they have in society. Our role is to look at the effects of climate change through health, and to focus on actions that bring benefits to health. So our role is boundaried through health and the delivery of health care. Now, Claire's touched on some of the effects of climate change on health, so I'm not going to dwell on these significantly, but we know that there are a number of risks to health, direct and indirect, that are challenging us now, here in the UK as well as other countries, and global warming isn't happening uniformly across the planet. So different countries are experiencing different effects, but there are definitely going to be effects on health, and anything that affects health affects the prevention of infection. So I said at the beginning I wanted to mention mitigation and adaptation. Mitigation really describes a lot of what we've talked about today, which is around minimising or reducing the risk of the threat. In this case, it's around greenhouse gas production. So we talk about net zero, we talk about reducing our carbon footprint. That's mitigation. But increasingly, and actually some people are saying we need to put more focus now on adaptation. So that's about thinking about now how we're going to build resilience into our buildings, into our systems, into our health and care services to adjust when we are in a different situation. So this slide here really just describes what we need to do, some examples of mitigation and adaptation. So it's about acting now, but also about building into our plans and our thinking, and particularly our supply chains, which are going to be really potentially quite threatened in the future, both in terms of consumables, but also food. What are we going to do here to make ourselves resilient? But when it comes to infection prevention and control, what might that look like? Because we don't actually know what it's going to look like at the moment. So infection occurs when a pathogen enters the body and we get an inflammatory response, and signs and symptoms, whatever those may be, in our patients. It's not quite the same as an infectious disease, although you can experience similar symptoms. And when we talk about infectious diseases, we are talking about bacteria, viruses, fungi in particular, a real concern that can spread from person to person. And these aren't necessarily the exotic diseases that you get when you go away on holiday. So if we're thinking about healthcare-acquired infection in particular, in our health and care services, particularly healthcare, so this is predominantly hospitals now, what sort of challenges are we going to face in addition to a warming planet? Because this is contextual. Infection prevention and control is always contextual. Well, the really big one for me is what's going to happen with our age demographics over the next 20 years. So with ageing comes particular challenges and particular risks for the delivery of healthcare, but also for the susceptibility of infection for our patients. And of course, this was happening, this was projected even before we had COVID-19, and now we have long COVID and we have immune disruption. We don't quite understand what this is going to look like in the future and the level of and types of vulnerability that we're going to experience. But we are going to have to invest an awful lot of energy thinking about the care of elderly people and how we prevent infections with them. And I'm going to be one of them. So I need you to really think about that. We need to think about what's it going to be like to be a healthcare worker on a warming planet where warmer temperatures actually become the norm. If you work 12-hour shifts and you're going through the menopause, it's already a difficult place to be. But we're going to be asking staff to work, to make complex decisions, to be able to respond in extremes of heat. And that's not just in hospitals, it's in community settings as well. So it could be really very physically challenging to deliver care as time goes on. We also need to think about the status of our patients, as I've said, and in particular as we move care to the community, what does that look like if disruption occurs? So in non-hospital settings, what might changes in the epidemiology of infectious diseases look like and where infection control gets involved? Well, like many of you, I've dealt with umpteen outbreaks of scabies in my career. There is evidence, interestingly, from Southeast Asia that scabies outbreaks are increasing, and there's a positive correlation with increases in humidity. So it's possible that here, over time, that we will see increases in outbreaks, for example, of scabies due to changes in climatic conditions. With flooding is going to come changes to gastrointestinal infections and the spread of these. So some very simple examples, cryptosporidium, but also those associated with a flooding of farmland and excrement getting into drinking water. Tick-borne diseases, Lyme disease, watch West Nile fever. Just a hint there. And then foodborne contamination, as I've said, agricultural runoff increases in infections such as that. And what about fungal infections? So if we think about bacteria and viruses through zoonosis, actually we really, really need to be thinking about fungal infections. And if you were here yesterday, there was a really good presentation on fungal infections. And these are really hard to treat, not just because it takes so long, but because of their resistance and because of the harm to us as humans through treatment. Evidence does suggest that involving weather patterns are contributing to changes in fungal epidemiology. And this is likely to become far more challenging. So we need, for example, to be thinking about education of health and care workers, perhaps pre-registration in the case of nurses, not just talking about healthcare-associated infections as bacterial or viral, and we need to be educating our specialist workforce on fungal infections as well. So imported infections, so many of us may be fortunate enough to go abroad. You don't have to go far to potentially pick up an infection. Certainly Spain and Portugal and southern France are now starting to see significant increases in vector-borne diseases. You need to think carefully about where you're going and what the risks are. This is not just about malaria on safari in Africa anymore. We're seeing significant changes. So as different countries start to tackle and become aware of issues, gastrointestinal infections, tick-borne infections, and others are going to not just impact the tourist trade, but they're going to have an effect on our healthcare services as people return home. And with zoonotic infections, and I've used coronavirus there as just one example of a zoonotic infection, as there are many coronaviruses, of which animal species are the host, but there are many others as well. So this is really just to return back to where we started yesterday with the COVID-19 pandemic and the importance of learning to inform not just what we do in practice, but how we create resilient health and care services for the future. We don't quite know what it means to practice nursing sustainably at the moment, but what we do know is that there are three core components. There's the environmental aspect, the societal or the social value aspect, and the economic aspect. So when we think about sustainability, we need to be thinking all three. If you go back to that first slide I showed you with the light bulb and the green background, environmental sustainability draws people in. But when we think about sustainability as a whole, as Claire does on a day-to-day basis with procurement, we need to think of those other aspects as well. So we need to be raising awareness and we need to be educating people on what sustainability is and how we start to implement some sustainable practices by measuring these three different aspects of sustainability in the work that we do. So just to really sort of round up now, it can feel very daunting and it can feel very negative to think and talk about climate change because of the ways that we are going to have to change in our personal and professional lives. But actually, it's one of the biggest opportunities we have to improve health and bring resilience to our health and care system. So taking action on climate change through plant-based diets, through more active transport, by getting out of our cars, by acting differently, can have huge benefits for non-communicable diseases and long-term conditions. So it's an opportunity and a threat, so we mustn't be drawn into the negative. And we're starting to draw up what it might look like for health and care. So this is an example of a framework produced by the Centre for Sustainable Healthcare, Francis Mortimer, who works there, that talks about some of the principles. So patient empowerment and self-care, we can't do this without our public and our patients, so we have to start engaging them now. By focusing on prevention and the benefits to health, there are huge benefits financially and environmentally to our health and care services. Lean service delivery, something that we're always aiming for in terms of efficiency and looking for low carbon alternatives, minimizing waste, not using stuff we don't need to, being critical thinkers in practice. So what can you do now as you go home today? Maybe you'll be on the train having a bit of a think or having a think as you drive home. The most important thing for me is about awareness and using your transferable skills as infection prevention and control specialists to think about climate change and how we can bring things together in a way that benefits everyone. Thinking about it, raising awareness, allows you to start to become prepared, and that's a real positive. So do get educated, do stay interested. There will be bad days, but stay interested and work with others. And when I say work with others, I mean work in a multi-professional way, because there is huge benefits and learning to come from that. And this is constantly evolving. So things are going to change. Knowledge, guidelines, advice, you name it, is going to change. But that's okay, because that's about putting the learning into practice. So finally, what can you do now? And this slide is from the UK Health Alliance on Climate Change, of which the Royal College is a member, and I'm a trustee, very proud to be a trustee. And it's important to think about what we as individuals can do. So we can move better, we can fly less. We can't get rid of flights completely, but we can actively think about how we get from A to B if we have a choice. We can eat better. We can start to reduce the amount of red meat in our diets, or ruminant meat, so that's lamb, beef, for example. We can buy better. Think before you buy. Do I really need it? But also, am I buying cheap and cheerful? And sometimes there will be a time and a place for that. But actually, is buying better from more sustainable sources something that I'm able to introduce into my personal life? Practice better, measure our carbon footprints, learn to do carbon footprinting, campaign better, get involved, and talk about it. Talking about climate change to each other is something that's really beneficial to everyone, and it's helping us to come to terms with some of the challenges that we're going to face. And with that, I would like to wish you a safe journey home. Thank you for staying to the end. I can't give you a badge, but I would. Well, I wouldn't give you a badge, I'd give you something sustainable. But thank you, and hopefully we'll see you next year.